The first task you're asked to do is mark the fovea. This is the dark spot that you can see here. Click on it and then press Next. Your next task is to mark the optic nerve. This is the bright area here. First ask, can you see it? And if you click yes, it'll ask you to crop a box around it, allowing you to zoom in and get up close to mark some more features. When you click Next, you'll see the features, and the first thing it asks you to do is mark the outer perimeter of the nerve. This is best defined by looking at where there's a colour change. Here's a very nice clear example. You'll drag a polygon all the way around using this drag tool. Once it connects to a circle, click Next, and then it asks you to mark the cup, the inner hollow part of the nerve. Sometimes this can be done by looking at where there's a colour change, but the best way to see this is where you see the blood vessels take a little dip as they drop in. Sometimes there are no blood vessels, and so it's making a best approximation between previous points. Once complete, you'll get a summary screen, and then you'll be asked to see another one. Now here's an example where we can see the dark spot, the fovea, but the optic nerve is less obvious. It's partly off the screen. Here we can see about 2/3 of it. So you say, yes, I can see it, but only partially. It will still ask you to try and do the task. So crop your box and see it up close, and do the best that you can. You can still get useful information from this. This picture, not only is the disc almost out of view, but it's also very hazy. Despite this, there is still enough information here to work out if this is a healthy eye or not. So we mark our outer perimeter as best we can, and then here some of the blood vessels are quite difficult to see, but the margin between the light and the dark is a bit more obvious. Once you close the polygon, click Next to complete the task. Here we have one more example. Now the fovea here is less obvious, there's not the nice clear dark spot. So the proximate area is here, and you can see this is different to the other eyes where it's on the other side, and that's because the other eyes have been left eyes, whereas this is a right eye. Now if we zoom up close again not the clearest image, but you can make out that border of the nerve, so mark it as best you can. You can go either clockwise or anti-clockwise, whichever way you prefer. Once you complete the circle, it'll ask you now to do the cup. Look again for those kinks in the vessel. They can help you mark out areas where it's not so clear. And once complete, you're on to your next one.